Hi, hope you had a good Deepavali. Welcome to the latest episode of the Health Wrap by the Hindu. This week we discuss falling air quality post the festival, the carbide gun, a strange and dangerous toy, and the implications of the European review of ethanol likely to have a wide ranging impact on our lives. Do remember to stay on for our expert segment where Dr. Abdul Ghafoor, senior infectious diseases specialist, talks about how ethanol is being used today. So this week the air after Deepavali was really saturated with a lot of dust and suspended particulate matter, and it just became very hard to breathe in many parts of the country. It was very smoggy the night of Diwali even in Chennai, but the rains brought us relief. But other parts of the country were not so lucky, and the next day children, senior citizens, pregnant women have suffered severe respiratory distress, and some of them had to be hospitalized as well. We have a number of stories this week on that, Zubeda, and then I also want to bring up the strange device that came up last week. You know, it's the first Deepavali I am hearing of a carbide gun, which is apparently used to create noise in a factory or in a chemical industry atmosphere, but was used by the common people this Deepavali.
Absolutely, Ramya, you're right. Everybody experienced smog, I think, the day after Diwali. And as you rightly said, some parts of the country had it much worse than others. We were thankfully spared the worst of it because of the rains here. But it points to the fact that year after year we speak about this, and the air pollution problems get worse and worse, and yet nothing much is done about it. Coming to your second point about the carbide guns, yes, that it became a huge issue in Madhya Pradesh. We have some stories on that for our viewers to look at. The carbide gun is essentially a metal tube where there is calcium carbide and water, and together it makes acetylene gas, and this creates like an explosion. It is being marketed and sold as a children's toy, as a firecracker, which is shocking because no explosive device should ever be given into the hands of children, I would think.
On the subject of crackers, I'd like to bring in the big thing that happened before Diwali, which is the Supreme Court allowing the NCR region to burst crackers, green crackers.
Yes.
But all the same, a cracker emerges out of a chemical reaction which then produces smoke and fire, and that is the attraction of the cracker itself. So when we are talking about a country that is struggling with pollution and with air quality, I think we need to take a very a considered view about bursting crackers itself. Some countries abroad allow people to gather at one public venue and then burst the crackers. So is that a solution for us? I don't know, because and in Delhi for the court to give this approval and then have the lungs choked literally the next morning and that evening, I think is something that gives us pause, and it's a health issue as much as it is a pollution issue, because when we've always looked at One Health, and there is no separating the two, looking at incomes of the people who are in the cracker industry and the general health of the population of the country. I think that is very important for us to bring in that One Health perspective here.
Yes, absolutely. The One Health perspective is crucial here. Circling back to what you were talking about, how firecrackers do affect your health, these carbide guns in Madhya Pradesh, for instance, have injured over 300 people as of now, primarily children, because they're being used by children as toys, and a lot of them are suffering eye injuries. This is such an absolutely preventable tragedy that it makes us pause and wonder, why are we doing this to our children yet again? And speaking of eye injuries, we had another story that looked at all the kinds of eye injuries that children and adults can suffer, and how you can actually take care of your eyes better.
Yeah, we also had a number of stories on eye injuries post Deepavali,
Yes.
and we also had stories on that focuses on the health of the eye injuries, and how to do first aid and how to take care of your eyes. So we had that. But since we are on this subject of firecrackers, maybe we should also look at this whole topic of air quality index, and what is the air quality index. It is basically a scale that is used to measure pollution, and between a value of 0 and 50 means that the air is clean, and 51 to 100 is acceptable, and 100 to 200 means unhealthy for sensitive groups, certain sensitive groups, people with already existing COPD or lung conditions or respiratory diseases, children, senior citizens. Anything above 300 is severe. So, we know that post this Deepavali there were a rash of 300 plus readings across the country. So, and it is worse in cities where you have a winter, where the fog along with the smoke creates the smog that just covers cities, and people are unable to breathe in that sense. While Delhi is trying to create rain through cloud seeding and try to sort of alleviate the dense smog, as it were. I think it is important to look at consistently about the particulate matter 2.5, and it is important that we pay attention to this, because these are not obvious to the naked eye. They are much smaller than a human hair, and it can be solids or liquids, but it is impossible for us to perceive it. So, do we understand a threat that is not obvious to the human eye? So, that is something that I think as policy managers people should take it up and look at constant and be very serious about monitoring your PM 2.5 levels and the air quality index in general.
So, what people should realize about PM 2.5, as you were saying, Ramya, it is invisible, so obviously we can't see it. But the fact that these particles are so tiny allows them to penetrate really deep into our lungs and enter our bloodstream as well. So, that is what makes them so dangerous, invisible, and yet like causing insidious damage inside your body. We have written a lot about this, not just with regard to what is happening in Delhi post the festival season, but what is happening in the rest of India, and why this should be a conversation we should be having all year long, not just in winter and not just after a festival.
Yeah, so when the AQI is high, some of the recommended techniques that doctors urge one to apply are one, to avoid going out if that is possible, to use air purifiers inside homes, offices, and any closed space where you can use an air purifier, and staying hydrated throughout. Making sure that you get enough hydration, and if you have to go outside, then wearing a mask when the air looks hazy. So, these are the number of tips that one can take, but this is only trying to prevent things from going from bad to worse, because things are already bad there. And how do you protect yourself? This is only protection mechanism. I think the role of the state here is to ensure that a good quality of air is present in towns, in cities and urban centers, so that people can live a healthy life.
That's the key thing here, isn't it? The healthy life part, because more than it is, of course, a huge environmental concern, but it has to be seen as a public health emergency as well. Living without access to clean air should be seen for the absolute emergency that it is in our country.
Yeah, until that happens, I think there is no hope whatsoever. So, this week we have on a slightly different topic, we have with us Dr. Abdul Ghafoor. He is a senior consultant in infectious diseases at Apollo Hospital, and he will speak to us about a recent news that the European Chemicals Association is planning a review of the use of ethanol. And ethanol, as we know, is the primary component in hand rubs, hand sanitizers, used very, very commonly now in society, in our homes, and primarily in hospitals. Welcome to our studio, Dr. Ghafoor. Thanks for taking time out here.
Thank you, Ramya.
So, today we'll discuss something slightly different to what we are used to discussing. This is about the European Chemicals Association. It's a ongoing review of ethanol, which we know is an essential part of alcoholic hand rubs that most people are used to after the COVID pandemic.
What does this review mean in this context? Why are they reviewing the presence of ethanol or the use of ethanol itself?
I'm an infection doctor. So first I will look from an infection doctor's or a doctor's perspective. Every day we use alcohol hand rub to clean our hands before touching patients, after touching patients, before doing any procedures, after procedures, and even if you touch the patient's file or door handle, we use alcohol hand rub. And we do it dozens of times a day. And around the world, millions of healthcare workers are doing it. Why we do it? Because it reduces the healthcare associated infections by half. The most important measure to reduce infection in the hospital is alcohol hand rub and hand hygiene using alcohol based hand rub. Now, alcohol is used not just in the hospital, it's used in several industries. Now, recently the proposed changes, European Chemical Association, the ECHA, has initiated consultation on reclassifying ethyl alcohol. The alcohol that we use is ethyl alcohol, the same chemical that we drink as alcohol too. That's the same as ethyl alcohol. To reclassify it as a carcinogen, that means it produces cancer. A mutagen, that means it can produce mutations in the body, or even mutation the unborn, so basically mutations. And reprotoxic means toxicity to the reproductive system. That means you can have infertility, you can have fetal miscarriage, or maybe defects in the newborn, or maybe developmental delays in the child. This is called as carcinogenicity, mutagenicity, reprotoxicity, ECM. Now, this is what the European Chemical Association is consulting, because several European Commission members have requested this change because of the emerging evidence. So what does that mean? The HR wants ethyl alcohol to be category 1A or 1B. That means known. Known means proven or presumed carcinogen or reprotoxic. The implication is, if ethyl alcohol, whether it is ingestion or inhalation, that means breathing, or even contact with the skin application, if it is category 1A or 1B, as per the European Commission regulations, there may be a ban on the use of ethyl alcohol or severe restriction on the usage of ethyl alcohol in medical, non-medical, and industrial usage. Now, what is the implication? If it is category A or B, and if there is no exception even for medical usage, we will not be able to use alcohol-based hand rub. I have a bottle of alcohol-based hand rub here. It has 70% ethyl alcohol. 70 ml, out of 100 ml, 70 ml is ethyl alcohol, and 2.5 ml of chlorhexidine. We call it as chlorhexidine alcohol. But the main component is alcohol. Why alcohol is the main component? Because alcohol-based hand rub or any disinfection, it works fast, it kills bacteria, it kills fungi, it kills virus very fast, doesn't need any water, and also it is least irritant to the skin. See, we healthcare workers apply it dozens of times a day, and many of them cause irritation to our hand. If there's irritation, the compliance will be low. Even otherwise, hospitals claim 80%, 90% compliance around the world. The real world evidence from the published data shows that even in the best hospital around the world, the real world compliance will be less than 50. What is document is different. The real world compliance is different. That could be below 50. Now, if there is restriction or a scare on the usage of alcohol, this compliance rate is going to reduce further. And the most important infection prevention tool will be discouraged, leading to increase in infection in the hospital, increase antimicrobial resistance rate. At a global level, 5 million deaths every year is due to antimicrobial resistance. And majority of these deaths are because of hospital-acquired infection. In Europe alone, every year, 4 million people in the hospital get hospital-acquired infection. And 90,000 die in the Europe alone because of hospital-acquired infection. It's a serious problem, and alcohol-based hand rub plays a significant, unavoidable role in reducing deaths and morbidity, mortality due to hospital-acquired infections.
Right. Thank you, Doctor. That's really elaborate. Just to clarify a few points. So, will this review also include the opinions or the scientific evidence in front of the in front of the medical world of the actual use of hand rubs and its effectiveness in controlling infections? Will this be a part of their review as well?
Now, there is a big difference between how European Chemical Agency approach the problem, how we medical bodies like medical associations or WHO or UFFDA or Indian CIDSCO approaches. We regulators, medical regulators and bodies approach the problem entirely different way. We approach it risk-based. For example, if we have to call alcohol as carcinogen and reprotoxic, we need real-world evidence from human studies. For example, if you apply on the alcohol on the skin, very minimal amount is absorbed, negligible amount is absorbed or inhaled. At the same time, you drink a lot of alcohol, it's a lot of alcohol. Or a very high concentration industrial exposure, that's a lot of alcohol fumes. But that's different from small amount of exposure in the medical. In the medical world, from the human evidence, there is no real evidence that alcohol that we apply on the hand in the hospital is either carcinogen or mutagen or reprotoxic. So whether WHO or medical organization or regulators are strongly supporting usage of alcohol-based hand rub. But European Chemical Association's approach is entirely different. They call it as hazard-based approach. That means even any level of evidence, experimental evidence or animal evidence at any level of exposure. It doesn't have to be really real-world exposure. Hypothetical evidence based on any level of exposure is called as hazard. That means any possibility for a harm is hazard. That is how European Chemical Association follows officially. But medical bodies, any harm, there should be real-world evidence. So the approach is entirely different. It's a different approach, but this different approach is going to create some problem in the real life, because if HR class, first it's a protocol. European Chemical Agency has got a risk assessment committee. They are the one reviewing as per the recommendation of the member countries. Now, if the risk assessment committee include it as category A, or category 1A or B, that means known or proven or presumed, there will be a near ban of alcohol use in all the areas, including medical. What we are asking for is an exemption for the medical usage, for alcohol hand rub and for disinfectants. Because once there is exemption, even if there is a ban for other fields, there is no problem of using alcohol hand rub as a disinfectant. That's what we want from the medical side. Now, if category 1 and B, there will be a ban if there is no exemption, but still we can apply to there is something called European ECCS, European Council for Consumer Safety. They may give an exemption later, or we call it as derogation. Exemption at the later stage is called derogation. What we need is exemption for the ban, for the beginning, for medical exemption, so that there is, otherwise, even if there is a derogation later, we may have to add on the bottle, biohazardous, reprotoxic. If you add that on alcohol hand rub bottle, the compliance by the doctors and nurses will be still lower. And that's going to make a significant impact. So what we need is exemption from the start based on because the risk is hypothetical, it's only hazard, but the benefit is huge, it's unavoidable, it's essential. So we want an exemption, and we believe we'll get an exemption. Now, what is going to happen if it is category 2, not category 1 and B, what HR wants, only category 2, then there will not be a problem because there is no ban. There may be a biohazard, but we believe that medical field will be definitely exempted. Now, what the alcohol use in the hospital is different from the community, home or school.
Right.
That exemption depends on category 1A or 1B. If it's going to be category 2, yes, everybody can use alcohol hand rub without a biohazard warning. If there's a category 1A or B rule ban, even if you get an exemption, that will be for the hospital usage, not for the community usage. There are a lot of legal implications.
Right. So this seems to be a gulf between understanding of use in the real world and a merely scientific interpretation of the data available. The other thing I wanted to ask you, Doctor, is something that we use ethanol, ethyl alcohol for in our daily lives, which is not hand rubs, but is perfumes and fragrances. And I know you also have a passion for fragrances. That is also applied on the skin. I know you said that the absorption skin wise, dermally, is very low, but uh, can you elaborate a bit more about ethyl alcohol in perfumes itself?
Yes, Ramya, that's a very interesting aspect. And before that, I would like to mention this is only consideration by European Chemical Agency, applicable only to European Commission. But we do know that one major region make a legal change that will have repercussion around the world. Now your question of perfumery. We all apply perfume. I'm a big connoisseur of perfume. I apply perfume, including alcohol-based perfumes on my hands and neck. But that is negligible amount of alcohol, very negligible absorption, small amount of alcohol, negligible absorption. But alcohol is a very important component in perfumery. If you take a perfume, majority, 80% of it is alcohol. And around 20%, 10 to 20%, the fragrance component. And why alcohol is very important? Without alcohol, if the alcohol is the one that produces the blast or the evaporation of the volatile organic compound. Without alcohol, can you formulate perfumes without alcohol? It's possible. Water-based perfumes are available. The problem with water-based, you will not get the same experience or performance of the alcohol-based perfume. Only less than 2% of the perfumes used is water-based. Well, yes, there are a lot of research going on in the water-based, new technologies emerging. That will all take a long time. Alternative options are available, new chemicals are available. Oil-based, of course, others are available. We know that it's not alcohol-based. Yes, there are alternative options available, but the perfume industry is currently dependent on alcohol. The performance is always better with alcohol. But of course, when the regulators review the classification, I'm sure they will consider medical side as an essential entity. I don't believe the perfumes and cosmetic will get the same level of attention that medical field get. If the classification is going to be category 1 and B, then the cosmetic and perfume industry is going to be in trouble. They have to make the change in 2 years' time. If it's going to be a category B, category 2 reclassification, yes, it's not a ban, but still the consumer confidence will be touching. And that will affect the business to an extent. So yes, it may affect the perfumery, cosmetic, and alcohol used in pharmaceutical industry. A lot of cough syrup, drugs, creams, and that food processing industry, laboratory industry, agriculture industry, and petrol. Now, 10 to 20% of the petrol, the good quality petrol is ethyl alcohol to increase efficiency. So it's a major industry, serious economic repercussions. So even though many of the European member countries are pressurizing for the regulatory change, there's a strong pressure from the industry, including IFRA. IFRA is organization of the fragrance, IFRA, and IFRA has got a scientific body called RIFM, Research Institute for Fragrance Material. They are now generating evidence that alcohol on the skin is not toxic. So even if the European Commission, regulatory agency, and European Commission make it category 1 or category 2, the reform will be providing data to ECCS later for a derogation, even if the ban happens.
Thank you for joining us today, Dr. Ghafoor. Those were very insightful thoughts on this subject. Ramya, is it time for the fun fact now?
Yeah, so we spoke at length about using hand rubs and alcohol in hand sanitizers. And but as parents, we know that little children are fond of licking,
Yes.
somehow something there fascinates them. So did you know that manufacturers are actually required to add bittering agents to the hand sanitizer in order to make it specifically unpalatable? I mean, this doesn't stop the kids, maybe they're not reading the instructions. But in between May and June 2020, in Arizona and New Mexico in America, 15 cases of methyl alcohol poisoning were reported with severe injuries and side effects. And this was, of course, the methyl alcohol is not usually present in the hand sanitizer, but was added by mistake apparently. So, like I said, I am not sure if this is a truly fun fact, but then this is a fact that we have to keep telling our children at least.
It was an interesting fact at least.
And that's a wrap. For these stories and more, scan the QR code displayed to the left of me and it will take you to the health page of the Hindu. Thank you for watching the Health Wrap.